Precious mothers, God, reviving humanity. We shall make it because happy women makes happy nation. In the name of Allah, we shall succeed again. Precious mothers, God, reviving humanity. We shall make it because happy women makes happy nation. In the name of Allah, we shall succeed.
Alhamdulillah, it is exactly 8 p.m. Dear precious mothers, if you are online, please signify with your best emoji.
Assalamu alaikum warahmatullahi wabarakatuh. Yeah, my name is Dr. Shitu Khadija. Like I said earlier, the topic for today's discussion is PID. That is Pelvic Inflammatory Disease. I'm sure we must all have heard about this topic previously. If we add, can we signify by raising up our hands? Thank you. Okay, so we can start. PID, like I said earlier, stands for Pelvic Inflammatory Disease. It is a general term that signifies series of infections and inflammation that can affect the pelvic organs. When we talk about the pelvic organs, let me start from the outside. We have the vulva. The vulva is the outer part of the female genitalia. That's if I ask a woman to lie down and open her legs, what I can see outside is the vulva. So the vulva, then the vagina. Of course, we all know what the vagina is. The vagina is the inside. That is the site of sexual intercourse. So during sexual intercourse, where the penis stays is the vagina. So the one outside is not the vagina. What we can see outside is the vulva. The vagina is the one that is inside. That is where the penis stays during sexual intercourse. Then we have the cervix. The cervix is the mouth of the womb. That's the entrance of the womb. Then we have the womb itself, which is the uterus. Then, following the uterus, we have the fallopian tubes. There are 2 fallopian tubes, and this is where fertilization takes place. So the woman's egg and the man's sperm, they join together in the fallopian tube to form one. So that one thing that they form is called the zygote. So it's the zygote that will develop and form the baby. Now, after the fallopian tubes, you have the ovary. We also have 2 ovaries. The ovaries are the sites where the eggs are produced, where the eggs are produced every month. And then we have the pelvic tissues. Yeah, let me stop there. So those are the organs that make up the female genitalia. So infection involving this is pelvic inflammatory disease. Yes, so let's continue. For the purpose of definition, pelvic inflammatory disease only affects the upper genital organs. That is from the uterus, the fallopian tubes, the ovaries, and then the pelvic peritoneum. When you have infection of the cervix, the vagina, and the vulva, those ones, they cause vaginitis and cervicitis. Let me not bore us with too many definitions. I just thought that I should make that clarification. Now, so when infection occurs, and when infection affects the womb, the fallopian tubes, and all those internal genital organs, that's what we call the pelvic inflammatory disease. Now, what are the causes of pelvic inflammatory disease? We have some causative organisms that can cause them. I'm sure we have all heard about gonorrhea, chlamydia. Those are the common ones that all of us that we know. Of course, there are much more than that. But those are the common ones. Chlamydia, gonorrhea, things like E. coli and the rest. They can also affect the pelvic organs. Now, because we are not medical people, let me just stop there. Those are the common ones that we know. Now, what are those things that we can do that can make us have pelvic inflammatory disease? I'll be calling it PID henceforth. We all know the meaning now. So, most of them are sexually transmitted. So if a woman who is infected has sex with a man, or a man who is infected has sex with a woman, then both of them can transmit it. Of course, I'm sorry for the earlier break. I had a call coming in. So as I was talking about the causes of PID. So the first one I said was most of them are sexually transmitted. So having unprotected sexual intercourse puts one at risk of having PID. And of course, okay, don't worry. I'll go to the risk factors later. Let me just stick to the causes now. Sexual intercourse, then introduction of foreign bodies into the uterus. Like for example, I'm sure we must all have heard about intrauterine contraceptive device, IUCD. So if you have an IUCD inserted by somebody who is not so good with the hygiene, then we can introduce foreign body into the womb. Then procedures like termination of pregnancy that we all know as abortion, if it's not done in a very hygienic environment, or if hygienic instruments were not used, they can cause PID. And then other medical procedures for those of us that have been trying to get pregnant. I'm sure we must have heard about something called HSG. It's a type of X-ray that is done to look at the fallopian tubes and the womb. So any medical procedure that involves going through that center of excellence, if hygienic instruments are not used, or if it's done in an unhygienic environment, then foreign bodies can be introduced into the womb, and then that can cause PID. Then other surgeries, major gynae surgeries, can also cause pelvic inflammatory disease. For example, myomectomy. That's a surgery that involves removal of fibroid. If the surgery gets infected, of course, you are working directly in one of the organs, which is the womb. That can cause pelvic inflammatory disease. Then infection in the gastrointestinal tract. I'm trying as much as possible not to use medical words. Infection in the gastrointestinal tract, like the stomach, the duodenum, and the likes, it can spread. If you look at the stomach and the pelvis, they are very, very close to themselves. So if there is an infection in the stomach area, that's the abdomen, it can spread to the pelvis and cause PID. Then tuberculosis in any part of the body can spread to the pelvis to cause PID. And then if a woman has just delivered, if she delivered in a place whereby the hygiene is not that standard, and then unhygienic instruments were used on her, then she can come down with PID. So those are the causes of PID. Now let us talk about the risk factors of PID. Now when we say risk factors, these are some of those things that if you have one or more of them, or if you engage in some of these things, you stand a very high risk of having PID. Now, what are those risk factors? The first one is young age, usually less than 25 years. Females that are less than 25 years are at risk of having PID. Why? That is because at this age, they, alhamdulillah, we are Muslims, so I don't expect us to fall victim of this. But because they're still young, they usually want to experiment a lot of things. So the risk of having multiple sexual partners is high. And don't forget, I said, when we're discussing the causes, I said many of them are sexually transmitted. So any woman who has multiple sexual partners stands a very high risk of having a PID. So young age, less than 25 years, having multiple sexual partners, and then IUD use, like I said, for those of us that use intrauterine contraceptive device, if it's not properly inserted, or if you do not take adequate care of it, then we stand a risk of having PID. Then, of course, people in unstable relationship, you are dating this guy today, he jilts you, you move on to the next guy, it doesn't work out, you try another person again. So things like this puts one at a risk of having PID. Now, what are the signs and symptoms that we see that will make us think that, oh, I think I'm having a pelvic inflammatory disease? The first thing we notice is abnormal vaginal discharge. Now, let me state this. Every woman has discharge. The vagina has, the cervix has some glands. We all know what the cervix is. That's the mouth of the womb. And the vagina, there's some glands there that they produce some secretions. So every woman has discharge. But what does normal discharge look like? It should not be plenty. It should not have color. It should not smell. And it should not itch. So once your discharge goes away from any of these, that's if it smells, or it itches you, or it is plenty, or it has color, then that discharge is abnormal. So the first thing I'm talking about is abnormal vaginal discharge. Usually it is plenty and it smells. For women that have PID, they will have foul-smelling vaginal discharge. Then another thing we can have is lower abdominal pain. So I talked about abnormal vaginal discharge. Then other symptoms we can have is lower abdominal pain. And then there could be fever. Fever, that is high temperature. So there could be fever, there could be lower abdominal pain, abnormal vaginal discharge. Then general symptoms. Now, when it has spread to involve the whole body, then you can start having things like nausea and vomiting, headaches, feeling of unwell, as the one feels sick. So any of these could be symptoms of PID. Then when you go to the doctor and then the doctor checks, of course, the person, there could be fever, and then when the doctor presses the lower part of the abdomen, then the patient might feel pain. Then when we do a vaginal examination, the vaginal examination on moving the cervix, on moving the cervix, which is the mouth of the womb, the person feels so much pain. So we call it cervical motion tenderness. So when the doctor moves the cervix, the patient feels pains. In fact, inserting the finger into the vagina itself is painful. So once you have all this, or any of these, two or more of these, then you can say the patient has PID. Other symptoms, yes, before I forget, is dyspareunia. That's painful sexual intercourse. Sex is supposed to be enjoyed. But with PID, we might not enjoy it. We might feel pain, rather. Then it can even cause intermenstrual bleeding. That's irregular. Let me just put it as irregular bleeding. I've menstruated the normal time I was supposed to see my period. And then, just before I'm supposed to see another one, the period comes again. Irregular bleeding can be a symptom of PID. So how do we make the diagnosis? It's simple. Once we make any of these complaints, we can examine, we'll see some of the things I talked about, and then we can take a swab test. So the doctor will ask you to open up, we'll put in a speculum, and then we'll take a swab of the higher part of the vagina and then the cervix, and then we culture it. It could show us the offending organism, and then other things that we can also do, a full blood count. We're trying to see for the evidence of infection in the blood. Now, having made a diagnosis of pelvic inflammatory disease, how do we treat? It depends on what the patient presents with. If it hasn't spread, that's if it hasn't involved the body, that's the patient is not sick, then it's just drugs that we use. We don't need to admit. Usually, we use more than one drug. We can use as many as 3 or 4 drugs to treat, because we know that sometimes PID can be caused by more than one organism. So we usually want to treat for all the common organisms that cause PID. So you can be treated with as many as 3 or 4 drugs, depending on what we think is the infecting organism. And then usually we treat for minimum of 14 days. Yes, 10 to 14 days. Sometimes you can even go higher than that, depending on how the patient presents. So I want to continue with the treatment. So the first one I said was if the patient is not sick. Now, in a patient that is acutely ill-looking, that's I'm trying not to use medical words. So if the patient is feeling sick from PID, fever, nausea, vomiting, generalized feeling of unwell, then we might need to admit that patient. Now, when we admit, I forgot to talk about scan. In making a diagnosis, we can also do a transvaginal scan. So, back to the treatment. When we admit the patient, We want the patient to have adequate bed rest